Thanks, Lori. Good evening, everyone, and welcome to the Rochester Academy of Medicine. My name is Maureen Geisler, and I'm a graduate student at the University of Albany School of Public Health and an intern at the Academy. I am also a pharmacist at the Anthony L. Jordan Health Center here in Rochester. Tonight's program, Caring for Communities in Times of Crisis, is part of the Academy's book series. The suggested reading for this program is Code Blue, a Katrina physician's memoir by Dr. Richard Dykman. The book chronicles the evacuation of Memorial Medical Center in New Orleans in the aftermath of Hurricane Katrina. As floodwaters rose, the staff of Memorial faced horrific conditions and difficult decisions as they worked to care for patients and evacuate the hospital. Disasters come in many different forms. Just in the past month, we have witnessed wildfires in the western United States, a devastating earthquake in Haiti, Hurricane Ida, among others, which caused deadly flooding from Louisiana to the Northeast, and we passed the 20th anniversary of 9/11. And of course, we are all continuing to cope with the COVID-19 pandemic. The communities affected by disasters include not just the area where the emergency occurred, but the people who respond to them, such as the healthcare, emergency response, and law enforcement communities. There are important lessons to be learned from these events to better prepare for future crises. Failure to document these lessons means valuable experiences are lost. It is also essential that we care for ourselves and our communities during and after crises. Tonight, we'll hear from our panelists, hear their stories of responding to disasters and some of the lessons they've learned. We will also discuss some ways of caring for ourselves and our communities in the face of crises. A couple of housekeeping items. If you have questions for our panelists, please submit them through the chat and we will get to as many as possible within the time frame of the program. Following the program, you will receive an evaluation by email. Please complete and return the evaluation to us as it helps us with future programming. The evaluation does include a place to request continuing medical education credit. If you'd like to get CME credit, please be sure to complete the form. Along with the evaluation, we will include some references and suggested resources for personal preparedness, planning and for yourselves, your patients, or your community members. None of tonight's speakers have any financial disclosures. And now it's my pleasure to introduce our panelists. Kristen Bloom is the Director of Infection Prevention and Emergency Preparedness for UR Thompson Health in Canandaigua, New York. Kristen has been responding to the COVID-19 pandemic for the past 19 months, and this year she received a Healthcare Hero Award from the Rochester Business Journal for her work on the pandemic response. Kristen is also a volunteer firefighter with the Macedon Center Fire Department. She's hazmat trained and a disaster response volunteer with Team Rubicon. Kristen recently deployed with Team Rubicon to respond to flooding in Baton Rouge, Louisiana. I'm hoping Antonio Lagares will join us. I know he's been working a ton of hours. He was a surgical intensive care nurse at Rochester Regional Health prior to becoming a travel nurse. And as a travel nurse, Antonio has responded to the COVID-19 pandemic in New York City and Texas. So hopefully he'll be joining us shortly. Louis Rotkowitz is an attending physician in emergency medicine at Queens Hospital Center in Jamaica, New York, which has put him on the front line since the start of the pandemic. Lou also works with the Fire Department of New York City, serving as a medical advisor to the incident management team, and a city medical specialist, which has included work on the World Trade Center Medical Monitoring and Treatment Program. Lou provided disaster relief with the Medical Reserve Corps following Superstorm Sandy in 2012, and he currently volunteers as the medical director for the Bay Community Volunteer Ambulance Corps and the North Shore Rescue Squad No. 1. And Dominic Vicenti served with the New York City Police Department for 3 years and the Fire Department of New York for 20 years until his retirement last year. During his tenure with the Fire Department, Dom became a licensed master social worker and worked with the FDNY Counseling Service for the past 11 years. He also worked with the FDNY Addiction Treatment Program for several years. Dominic has worked extensively with the International Association of Firefighters, deploying as a clinician to assist the community of firefighters following multiple disasters, including fatal shooting incidents and most recently, the Champlain Tower collapse in Miami. And those are our panelists for tonight. And I'd like to start with Kristen, if you would tell us a bit about your work and your response to disasters. Thanks, Kristen.
Hi. So I was gonna go over, just discuss a little bit about Thompson Health's experience, mainly with the first wave during COVID-19, and diving into after action review and how some of those lessons learned are still impacting us today. Let's see. So in the beginning, we were given the gift of time. We watched what was happening in New York City, and we had time to cross-train, create alternate care locations and surge locations. However, this time had its faults too, as people became very fearful, and the more time we had, the more time we had to overthink. Quote Lord of the Rings, I don't want to be in a battle, but waiting on the edge of one I can't escape is even worse. This was absolutely the feeling in the hospital. The anxiety was palpable. If we had dived right into disaster response with so much time, without so much time to anticipate, a lot of anxiety would have been saved. We prepped for the worst. At one point, I received a call from a New York State representative to change from mass casualty planning to mass fatality. We had our temporary morgue set up, we stocked extra body bags, and we waited. Luckily, the surge we got was nothing like what was experienced in New York City. We were able to handle what came our way and did very well. It was not without its difficulties. We struggled through lack of supplies. I remember one Saturday afternoon getting a call from the ED that we had one glide scope blade left to intubate patients and had no idea when we were getting any more. What do we do? That was a very helpless feeling, but we got through it. We got through it. We were able to start working through our recovery and reopening plans. Getting through the first wave, we came out stronger and we came out confident. And it was at this point that we took a deep dive by working through the after action review process. And at this point, I'll just kind of go through some of the interesting findings that are still kind of affecting us today. One thing in going through this, I have the interest or the perspective of looking at things as an emergency planner and as an infection preventionist. So when I did this after action review, I looked at it from both angles. Clearly not enough attention was put into the psychological effects of COVID-19 on our healthcare workers. While we did not experience the surge in mortality that other areas such as New York City, the fear and anxiety still existed among associates. The psychosocial effects alone from the lockdown on personal lives, combined with fear of occupational exposure, had negative effects on our staff. Fear led to misuse and overuse of PPE, refusal of patient assignments, and decreased patient interaction. Departmental interpersonal influences seem to have a large effect on perceived risk, anxiety, and compliance, in addition to intrapersonal influences. While the healthcare system touts a culture of safety and had initiated institutional policies and environmental protective measures to support the safety of culture, we found that intra and interpersonal influences seem to be the driving factor with health behavior. We had identified a wide range of perceived risks and anxiety levels associated with COVID fear. Fear and anxiety levels seem to be dependent on department, with some of the least at-risk departments harboring the most fear, while those with the most exposure to COVID patients having the least fear. We also found a similar correlation with PPE compliance, as those working in highest risk areas were often the least compliant with PPE, while those in low risk areas were overutilizing PPE. Many healthcare workers experience stigma by families, coworkers, and the communities due to their affiliation with working in healthcare or their infection status. Experiences of stigma increase healthcare workers' levels of stress and anxiety in an already anxiety overloaded situation. Stigma sometimes resulted in denial of healthcare appointments, along with other services based solely on their employment status. Those associates that did become infected with COVID experienced stigma from their colleagues, creating more anxiety associated with recovery and returning to work. During the first wave, the community really came together to support healthcare systems. Social distancing, hand hygiene, universal masking campaigns became a cornerstone in communities. communities embraced these prevention methods as something they could participate in. Many members of the communities saw the state reopening as a signal to return to normal. Unfortunately, community movements gained traction at this point, including mask shaming, refusal to social distance, and denial of the pandemic. People became complacent. Adherence to PPE protocols went down. Staff increasingly made risky choices outside of work, including traveling to hotspot states. While in the beginning, social distancing, hand hygiene, and universal masking were positively viewed by the community, discordance developed in the communities, causing a split between those who believed in prevention methods and those who did not. Influences such as peer pressure to comply and not comply with prevention methods started to emerge. Social normalization of these prevention methods began to disintegrate, leaving contention between the two sides. As people returned to work and patroned businesses, many employers and owners did not enforce social distancing and masking requirements, and the prevention methods that had worked to slow the pandemic became politicized. One of the problems with prevention is it's rarely observed what was prevented. The community expected the worst. Thankfully, we were able to flatten the curve and prevent a mass surge on our healthcare system, along with fatalities during the first wave. However, the public may have interpreted the lack of overwhelming disaster as a misconception that the danger was not as significant as they were being told. Mistrust in authorities such as the CDC and WHO also developed along with the politicization of the pandemic, resulting in a lot of misinformation. There was also the misconception that the need for social isolation would be a brief period of time. Once people began to understand this was not going away, social solidarity to stay home and save lives shifted individuals from focusing on the health of their community members to focusing on their own needs and needs of the economy. The second wave was tough, but we still had support from the community, which meant the world to us, and we had the promise of the vaccine in the future. The first vaccine clinic for healthcare workers was the first time I saw genuine hope in a long time. The relief and joy everyone experienced during those clinics was overwhelming. But the vaccine didn't come soon enough to stop the brutal blow we would be dealt with a surge of patients while simultaneously losing staff to infection. We had hope though because of the vaccine. There was frustration though with the community for ignoring social distancing and advice to avoid holiday gatherings. As I think most of you are aware, this continues to snowball into the third wave, as we have a burnt out workforce in a community that is no longer visibly supporting us, and in some cases even creating a hostile environment. When it comes to disaster planning, it is important to note that the findings from the after action review would not have come out from a drill. The psychosocial aspects that played into the pandemic response are not something a drill would elicit. However, their effects on our response were profound and continue to be an incredibly important factor as we now deal with vaccine hesitancy and mandates. These types of issues never crossed my mind before. Sure, I had thought about disaster mental health following an event, but never how important psychosocial behavior is to pandemic response. I was naive to think all healthcare workers have the type A run into the fire attitude that I'm accustomed to with the fire department and disaster response. And I'm not saying by any means that they should. What I'm saying is the lack of addressing psychological safety early on led to difficulties down the road that could have been squashed out early had it been a bigger focus. While I am confident that we will rise to the occasion and get through this very difficult time, it would be far easier with the support of the community again. We need to find a way to get back to supporting our healthcare workers and having a shared goal of protecting our fellow community members. I think one of the biggest awakenings here with my experience with the fire department and Team Rubicon is you have an event isolated to an area, isolated to a specific duration of time. It is a complete different ballgame dealing with a pandemic. We don't have an end game and it's affecting the whole world. So we can't rely on outside help, which the amount of unknown, it does cause a high level anxiety. But overwhelmingly, we have rose to every single occasion that this pandemic has thrown at us. Every impossible task that got sent our way that I said, there's no way we're going to be able to do this, we've done it. And I now consistently believe in achieving the impossible. And I know we'll get through whatever continues to come our way.
Thank you, Kristen. I really appreciate your comments. Next, we'll hear from Lou. Like I said, Lou has been an ED physician on the front line since the very beginning of the pandemic. So Lou, take it away, please.
Thank you. Thanks, Maureen. Thanks for having me. Tom, thanks for coming out. Kristen, I think there is an end in sight. I think we have the solution to the end of this pandemic. And from what I saw last night, this is going to be one on the grassroots level. The solution to this pandemic is the vaccine, and we need to get the message out. Yesterday, I covered the pediatric ER at Queens Hospital Center. I saw from 5 p.m. to 1 a.m. in the morning, I saw my first breakthrough case, and I've been working for a while. All these rumors of, oh, I got the COVID vaccine and now I got COVID again, or I pooped my pants, or whatever nonsense. So I actually saw my first case of a young 19-year-old girl who wasn't even really sick, but just needed to be reassured. I don't know. Things could be like, it could be the quality of the vaccine, but the vaccine is safe. The vaccine the vaccine works, and it's the solution. I want to share like a very personal situation that I had within the past couple days. I'm starting to see this. We're starting to see in the hospital this influx of immigrants, people that are coming into this country, particularly from Central America. And I had this elderly woman, she was in her 70s, from El Salvador. And not El Salvador, from Honduras. And she told me that she cleaned the floors using her feet with a bar of soap. She would put her feet on the soap, this gigantic bar of soap, and scrub the floors with this. You can't do that for that long. And she came into me not being able to walk. So when she came in, I spoke with her in Spanish, and her daughter was there, being overbearing. And I said, "Did you get the COVID vaccine?" And immediately, no, we're not getting that. We can't do that. And I'm starting to have this like resentment towards the patients that aren't being vaccinated, or that aren't accepting the vaccine. Many of my colleagues are starting to get this resentment. So I kind of let her sit for an hour. I did my thing, and we did an X-ray, and she came back with some bursitis. I spoke a little bit more to her, and I did something that I don't typically do. I gave her an injection into her hip with some medication. It's something that's done in like an orthopedics clinic. And it's one of these amazing feelings. She got up in like 20, 30 minutes and hugged me and said, "I can walk again." And she said to me, "I'll take your COVID vaccine tomorrow." So I think this thing is going to be one on the grassroots level. Just a little bit about me. I'm a student in the School of Public Health. I'm working towards my MPH. I work for FDNY. That's how I know Dom. He was one of my patients. I think maybe I violated HIPAA. We can file a complaint.
Okay.
But about a year ago, I had worked this through the inception. I had seen one of the first patients, the scare, the fear of everybody. And I had worked through the surge. And really, literally at the height of the surge, after seeing many cases, I had been wearing a papper, and we were sharing these pappers, and there was an emergency. I had gotten called to the bedside of a gentleman. He was the same age as me. He was in his early 40s. He was very sick. He had went into a flash pulmonary edema. He was very scared. And my papper failed. It broke off. And his secretions just went right into my mouth. And I've shared this story over and over again to the court. And 72 hours later, my life would change. But still dealing with some of the effects of it. But I was knocked out for about 3-4 months, but I've been back, back fighting it. I agree, Kristen. I'm probably one of the more guilty of being laxed with PPE. But I believe in the vaccine. I trust the science. There are a lot of people I see overreacting. I've seen people putting garbage bags on top of themselves. I've seen everything. The worst thing I think is just seeing people disseminate false information about the vaccine, particularly over social media. But the thing that's horrifying is just watching our colleagues, some of my colleagues, physician colleagues, politicize this and just drag this out. That's all I have. That's all I have to say.
Thanks, Lou. You bring up a good point about compassion fatigue, and I just want to let everyone know we are working on a program for later this fall on compassion fatigue called Compassion Fatigue, Putting the Caregiver First. So keep an eye on the Rochester Academy of Medicine's website. We'll be having more details about that. It's certainly a problem affecting not just healthcare workers, but I think also emergency responders, law enforcement, just everyone who's having contact with this really difficult situation. So, next, Dom, we'd like to hear about your experiences, of which I know you have very many. So take it away, Dom.
Thanks. So I really kind of fell into the field. I work for the FDNY. There's a counseling unit within our job, and there was a director of that unit that had the idea that people from the fire service maybe should get more involved in this field, because firemen, after all, often have a difficult time opening up and talking to people. And you're dealing with a lot of type A personalities and a population of people that really doesn't want to be perceived as weak. And the muscle memory that they use, or that we use, is firefighters are very good at helping other people. They're used to that. The bells go off, they go out the door, they're comfortable doing that, but it's very difficult for them to ask for help. And I find that with police as well. So I've been working with that population of people. In the middle of my career with the FDNY, I had the opportunity to go to social work school. When I was asked to go, I really didn't consider it. But fortunately, the director there left the door open, and it took about 3 years later, and I came back and I went to school. And because I did that, I had the opportunity to work with this population, not just with the FDNY, but I also started working with the IAFF, which is the International Union. So a lot of times they would send me to different events. I've been to a lot of shooting events. So Las Vegas, Midland, Texas, Dayton, Ohio, Parkland, which was a particularly difficult one, Charleston, and then a lot of weather-related events and suicides, whether it was Fairfax, Virginia, the Miami collapse, the Panhandle storm event a couple of years back, also Houston, Texas as well. So because of that, I had the opportunity to go to a lot of different of these events. Everyone is different. It usually is not the same. Some are more difficult than others, especially like something like Parkland, where it involves, young kids. But the population that I work with are the responders. And a lot of times when I go there, this event had just taken place, and I'm kind of planting the seeds for what may happen 2, 3, 4 months down the road. The DSM, for example, a diagnosis of post-traumatic stress can only be 30 days out. So, we're dealing kind of with the present when I'm there, but going forward, basically trying to reduce the stigma, that it's okay to speak to somebody, and also knowing that there's a population of firefighters or people that have been in the profession that are kind of willing to speak. And there are peer counselors, there are social workers that know what it's like to have been going through some of the things that some of these clients have went through. So that actually affords me greater opportunity to speak to them, and it kind of reduces a barrier that maybe many other people would have in dealing with that population. So that's pretty much it. I could talk specifically if you want about some of the particular events, but you let me know exactly what direction you feel I should go in. And that's pretty much it, though. That's my background.
Thanks, Dom. I appreciate that. We're going to start the question and answer portion of the program now. If anyone has questions, please put them into the chat box, and we will get to as many as we can. I have a few that have come in earlier, and this question is to all three of the panelists. What's the most important lesson you've learned from responding to COVID, to fighting fires, to responding to disasters, and in your case, Dom, working with responders who've had trauma from response? Would you like to go first, Dom?
Sure.
Thanks.
What's the most important thing? Is that the question? Most important thing, I guess, to keep in mind that, well, it's always about the client. It's about the person that responds. And something like trauma is one of those things. A lot of times I like to use the phrase, if we don't deal with trauma as it comes, it's almost like you eventually will deal with it, but you don't want to get hit like a tidal wave. So I feel it's so important to deal with the many traumas as we go. I think the most important thing, though, is the opportunity for especially a first responder, because with the stigma, the difficulty in being able to communicate with someone, having the confidence that he or she will be able to speak to somebody, I think that's the most important thing.
Thanks, Dom. Kristen, what's your insight on, you've responded to COVID, you're a firefighter, and you've done disaster response. What's the most important lesson you've learned?
Slow down. Slow down. Slow is smooth, smooth is fast. We tend to get very mission driven and just want to dive head first into things and just take a step back, think things through, slow down. In addition, again, with that mission driven attitude, is really take that step back and take that time to put yourself in the victim's shoes, put yourself in the responder's shoes, make sure you maintain empathy and compassion in a way that doesn't emotionally overwhelm you. But we really need to not get so focused in the work that we lose sight of the human aspect, and make sure that we are constantly displaying that empathy for the victims that we're providing services for.
Thank you. Thank you. What about you, Lou? What have been the most important lessons you've learned? You've done an awful lot of stuff, not just medicine, but also some of your work with the FDNY and other groups?
I think it's critical to maintain professionalism, to maintain control. But I think the most important lesson is something I learned in medical school, doing clinical rotations in England, is don't ask somebody to do something that you wouldn't do yourself. I think that's the most critical thing. When you're leading a team of people, and I think back to the night, that night of the surge, I never asked anybody to do anything that I wasn't comfortable doing myself. That's really what it's all about. And remember that these people don't lose sight of what you're doing. Just try to be godly. Do treat people well.
Thank you. Another question we've had is, what's the hardest thing about being on the front lines of a crisis or a disaster? Kristen, did you want to take that one first, please?
Ooh, I love being on the front lines. That's where I prefer to be. It's a lot harder to not be there. But what's the hardest thing? Definitely during COVID was leaving your family for extended periods of time. During the second wave, Christmas, New Year's, we weren't with our families. I went to work before my kids got up, and I got home when they were already in bed. That's the hardest. And then, of course, knowing that they're worried about you.
Thank you. Dom, what's been the hardest thing when you've been on the front lines, either as a firefighter, a police officer, or in your role with the counseling service and the responses you've done since then?
So I think in my role with the counseling unit, I think basically, of course, leaving family, sometimes you have to pick up and leave for 4 or 5 days. But I think it's really knowing what my role is and how I can be of greatest help. So it depends on what the situation is. Is it a shooting? Is it something pertaining to weather, with damaged homes or something like that? So I think the hardest thing is knowing what your role is, and fulfilling your role in the most productive way. So for a shooting, for example, you're dealing with a whole gamut of emotions. There's guilt, there's anger, and how you could best mitigate, whatever the circumstance is for any particular client. Sometimes there's actually substance abuse, and because of what somebody is going through, there might be somebody relapsing, medicating themselves, and that's the way they might deal with it. So I think every situation should be looked at on its own merits, its own terms. And I think the most difficult thing is knowing what your role is and trying to mitigate as best as you can.
Thank you. Lou, what's been the hardest thing for you?
I think it's being able to function outside of the chaos. It's sort of been easy just to put the scrubs on and go function within the chaos. But I have I think I've had to this has put things in perspective, that I have a shelf life, that this has to come to an end, and that I need to transition on to the next stage of my career. After coming back, I nearly didn't come back, but I just sort of feel like, that that movie of those army guys that were defusing the IEDs. It's just you're going off to battle every day or night or every tour that you're going into. It's just becoming too intense, and it eventually will destroy you. I watch it destroy other colleagues. Um, the substance abuse and mental illness that I see is just unbelievable. I think one of the worst things I witnessed was the death of Dr. Lorna Breen. She was the director of an emergency room in New York City, a young woman, and contracted COVID and forced herself back and ended up committing suicide. We still have not learned from that. We still haven't learned from that.
Thank you, Lou. Lori, could you read some of the chat questions, please?
Sure, yes, we have one that asks specifically for Dominic, but probably Kristen, you can contribute too. Do you think that it's gotten easier for the firefighters to open up over the years now that this program is more integrated into the community?
I would definitely say that is the case. I think what happened is because of the trade center, that was probably a precursor to a lot of things that were happening. And it was almost like the fallout from the trade center really forced the hand of the fire service to reinvent itself and to think outside the box. So many things after the trade center, whether it was substance abuse, anger management issues, grief, dealing with loss. I think that this population of men and women that were very type A really came to a point where that they needed help and they wanted help. And I think over the years, it's become, I won't say a lot more easy, but I think a lot of the stigma has been removed. So I think it's definitely going in the right direction.
Thanks. Any thoughts from you, Kristen?
I would say yes, it's going in the right direction. We certainly, I work in volunteer field and in rural communities, so our resources are less, but certainly if we have a fatality, things like that, there is a team that comes out, does hot washes. Will I say the stigma is gone? No. I still, a lot of old school mindset still that, we just don't talk about that kind of stuff. I will say I was at a different fire department and they had the poster on the fridge of how to seek help, and there were just little doodles all over it making fun of it, and that broke my heart. So there's work to be done. Processes are in place to address some of these higher, like fatalities, things like that. But I do think that we're really still lacking the encouragement of seeking out resources, seeking out help. At least in my environment, we have some work to go there.
Thanks, Kristen. We have one other question too, and Lou, you had spoke a little bit about the vaccination and how important it is. Do you have any ideas going forward as we're now dealing with the potential loss of healthcare members due to the
Muted.
Can I just make a comment? I stuck the little raised my hand thing up. I lost you. Is it okay to make a comment?
Yes, of course.
And there's somebody here actually in the audience today. I'm not sure if he's able to speak, but I work with a lot of, I have an appointment. I work for, forgive me, I'm sorry. I have appointments to NYPD and FDNY. FDNY, it's cool to get help. It's okay to get help. Nobody's going to stigmatize you or anything, and if they do, they're gonna get crushed. They will get crushed. I've seen people get crushed. But with the police department, it's very, very different because it has to do with that gun. And it's very, very difficult for these guys
Yeah,
to ask for help. Because the minute they ask for help, the first thing that they're doing is taking that gun away. And it can be devastating. Over the past couple of years, the NYPD has had like a rash of suicides. One person very close to me, a one-star chief, committed suicide at retirement. Separating from service for these guys is, for all of these people, even for myself, separating, when it comes time to separate from service, so to speak, it's going to be difficult. But for some of them, this is all they have. They give up that table at the firehouse. They see their world coming to an end. With that NYPD chief, he was nearing 62 years of age, mandatory retirement. He just couldn't envision his life past that. But for them, they can't. At the moment they ask for help, they're taking their gun. They're taking their gun.
Thanks, Lou. I have a few other questions that have come in. Let's see. During a crisis, ethical decisions have to be made, and sometimes we as healthcare providers, emergency responders, aren't really trained to make those decisions. How do you make a decision and then come to grips afterwards with the decision you've had to make? I don't know if you've ever been in that position, Dom, Lou, or Kristen, but do you have any insight into it?
yeah,
Ready to talk?
sure. I guess my field might be a little different than the other three panelists. Basically, I'm guided by what is the law, and of course, if somebody threatens to hurt themselves, to take their life, or to hurt anybody else, the law is, that I have to, that's a 911 call. So basically the confidentiality is critical, but as the law states, all bets are off if I have a client that's threatening to kill somebody or to take their own life. So I pretty much am just guided by that. And that's my role in terms of being ethical. Other than that, I would never violate the confidentiality of any client. And, that would be, something that even if I could do, I wouldn't want to do that. It would undermine the whole process.
Thank you. Lou or Kristen, do you have anything to add?
Yeah, we're in absolutely unprecedented times right now. These are not normal times. We are in the midst of a crisis. I have a license to practice medicine in New York State, and I'm going to use that license. And if a patient comes into the emergency room and they ask for something that's like reasonable, there's no such thing as primary care doctors. There's no such thing as specialists. So it's time to start thinking outside the box. It's time to start doing things that you don't usually do. It's time to start taking an extra minute to fill out some sort of form so that person can go back to work, because there is no primary care doctor for them to go back to. It's time to start renewing medications with refills on it, because again, these people can't get to a primary care doctor because the primary care doctors have essentially abandoned them. The entire healthcare system is, at least where I am, it's kind of like a free-for-all. And it's, I just feel a moral obligation to step up to the plate. And if somebody wants to question me, go ahead. I've given people, throughout the year, I've given I've written out several certifications for medical marijuana in the emergency room. And somebody could say, oh my God, how could you do that, Dr. Rockowitz? That's unheard of. Well, think about it for a second. What are the chances of one of these patients overdosing on opiate pain medications versus, getting a certification for medical marijuana and overdosing on it? It's about being reasonable. Unfortunately, a lot of my colleagues have not been reasonable. I see somebody making a comment there. I'm not saying this is, I apologize if I offended you. But I've seen a lot of people abandon their posts and walk away, close up their practices. And what's even more upsetting is the dissemination of false information and people not getting behind this entire vaccine thing. There's nothing political about it. I apologize if I offended somebody in the group. I'm just telling you from my personal experience. It's more on the level of, it's not even the doctors, it's the offices. You have just a poor work ethic. Oh, the pandemic, I can't do this, I can't do that. People not, office staffs not picking up the phones. People just falling back on the pandemic as just a way of scamming out. And I don't think twice about calling people out on it.
Thanks, Lou. Lori, did you have another question from the chat?
We do. I think I might have lost you guys with my volume, but we have another question as far as what ideas do you folks have in preparing for the potential loss of healthcare members due to the vaccination situation?
Kristen, you probably have been thinking a lot about that.
Yeah, lots of plans in place. I mean, certainly we had a little practice during the second wave where we had the most amount of patients we've ever had with the least amount of staff we've ever had due to staff going out with quarantine or due to infection themselves. We did a lot of cross training. As an emergency planner, it was really cool to see us bring in our primary care doctors and train them to be hospitalists and train them to work in the ED and train our OR staff to work on the floors and train our med-surg staff to do critical care, and really seeing how everyone was willing to step up and take on new roles and learn new roles was great. We utilized it. It worked well. Again, in the first wave, we shut down elective procedures. We shut down elective outpatient services, and we brought those staff into our labor pool and we used them as needed. And we have the same plans in place to do that again. We're already talking about limiting elective procedures and elective ambulatory services, reducing our urgent cares, and bringing those staff into the labor pool and redistributing our environmental services. We've already talked about how they're going to, they don't need to come clean my office. I can clean my own office. They need to concentrate on patient care. So we are just going to re-centralize everything and focus directly on what we need to do to keep our inpatients cared for and safe. So we do have these contingency plans. we don't want to use them. We certainly would prefer that everybody get vaccinated. It's safe, it's effective. There's no reason not to do it, but we have plans in place. The concern, of course, is what did we see after the first wave when we shut down preventative care? We saw a surge of non-COVID patients from delaying care. And so we know that doing this again will likely have the same results, but we'll get through it. We have the plans in place. And I think a lot of people are going to step up in the end. I think there's a lot of people kind of holding out the last hour, and we've had a lot of people change their minds already, and I just think a lot of people will step up for the love of their patients and hopefully, for the love of themselves, for their protection as well.
Okay. Gentlemen, do you have anything to add? Lou or Dom? Lori, do you have another comment?
Yeah, I do. And I know you've got a couple more questions, Maureen, but I do want to thank all of the healthcare workers who have, amidst all this frustration, continued to provide excellent patient care in our area and really, really across the state. From what we've seen, there's really a minority that cause the frustration for the majority. So thank you for all that you do.
Thanks, Lori. I had another question that was submitted earlier. What can healthcare workers or emergency responders do before, during, and after a crisis to help maintain their own mental health and well-being? Dom, would you like to start with that one?
Yeah, that's actually a great question. I think just to be aware, staying in the moment, obviously, first responders, that's really my population, so I could speak from that perspective. It's a difficult job with a lot of trauma, and it's trauma on an ongoing basis. So I think just to be aware that some of the things that we're dealing with, or that population deals with, just to be conscious that it definitely takes a toll. You see a lot of things that a great percentage of the population doesn't have the opportunity to see. You're being called to do things in critical times in people's lives, and it very often involves fatalities and loss of property and things like that. And it definitely impacts you when you respond, especially even more so what I noticed is when there's kids involved, especially parents, and sometimes it definitely takes its toll in terms of mental health. So just to be aware of it, that there's an ongoing trauma in this chosen profession. And sometimes we need to get some help and to mitigate.
Great, thank you. Lou, do you have any comments to add to that?
I've seen a tremendous too much death over the past year. I've seen some colleagues hide from it. I've seen a lot of cowardly behavior on the part of some of my colleagues. Whatever. At the end of the day, it just comes back to just doing what you have to do. I'm trained as a family physician working within the emergency room. And I try to bring that family medicine philosophy into the emergency room, just showing the respect to the family. I think one of the most challenging things I've had to do is to tell somebody in another language that their loved one is gone. And no matter how good you think you are at that language, or it's just a challenge. be one of the most, it'll be something that I'll never forget for the rest of my life.
Thanks, Lou. Kristen, do you have any thoughts on this topic?
So when COVID first came, I dove right into it and said, I'm going to give it everything I have, even if it destroys me. That was my mindset. I didn't take a day off. I didn't take any breaks. I just worked and worked and worked and worked and worked. Second wave, I found myself experiencing levels of anger I've never experienced in my life. I was finding myself crying in the middle of the night. Finally got it through my head that this just isn't going to work, and ended up finding some good coping mechanisms that work for me, and taking mental breaks. I was not disconnecting from anything ever. And as crazy as it sounds, going and doing work with the fire department is like my biggest mental vacation from the COVID response. Just going and completely doing something physical, manual labor. I love going and splitting wood, chopping wood, and really just having to admit you have a problem and stop trying to bury and repress everything. Facing your emotions head on and working through the grief. It's the only way you can do it. I'm very good at repression, and really discovered it was not serving me for a long time. So just that self-care is so important. It's so hard with those type A personalities. You don't want to miss a thing. You want to be available. If I'm not there, something's going to go wrong. I need to be there. I can't leave my frontline staff. I have to be available, but you're not available if you're not taking care of yourself. And we, as leaders, did not take care of ourselves after that first wave when we had a break. We didn't do the self-care we needed. We didn't take the vacations we probably should have taken. And we all went into the second wave burned out, and it wasn't serving anybody. So it is now a much bigger focus healthcare wide, that, for our frontline staff, for our leaders, for everybody, that self-care really needs to be at the forefront. And we have a lot more resources available for staff, and it is in our conversations every single day.
Thank you. A few more questions that had come in. How does your institution support frontline staff or staff in general in coping with the difficulties of whether it's responding to the pandemic in healthcare or things that happen in the course of firefighting or disaster response? Kristen, you want to take that one, since it kind of segues from what you just said?
Yeah, so again, what I just said, we really are putting that self-care, taking timeouts, taking breaks first. We are certainly working through staffing challenges right now, but one thing we're not talking about doing is restricting vacation time, anything like that. We know that our people that are showing up and are working, they deserve their breaks. We're going to give them their breaks. If you're in our elevators, if you're walking through our hallways, at our punching clocks, there's resources listed for mental health assistance. There's tips for self-care. Again, every single meeting we have, we're talking about this. We're making sure that our leaders are taking care of themselves so that they can take care of their staff. As far as Team Rubicon goes, from a very different perspective, responding to those disasters is actually self-care for the volunteers responding. Team Rubicon has a very interesting mission, whereas it is disaster response to help communities in need. But at the same time, it's giving veterans a way to transition back into civilian life and still feel connected and still feel service, still kind of have that same family dynamic they experience in the military. It gives them a purpose. So on that sense, when I'm responding with Team Rubicon, we are actually there really healing ourselves by helping other people. And it's a really cool beautiful thing to experience. We sit by the fire at the end of days. Everyone talks about their stories, talks about their experiences that have triggered PTSD in a very safe family environment. So that is a really cool organization that's really been able to pair helping others with healing yourself.
Thanks, Kristen. Lou, what are your thoughts? How is your institution helping you guys cope with this?
They're not helping. I've been called a fraud. I've been called a loser. I've been called unprofessional. A couple weeks ago in front of the workers' comp court, the opposing attorneys wanted to charge me with fraud. I've had numerous complications from COVID that have required me to apply for family medical leave as like a safety parachute, just to get people off my back. But the good thing is that the courts have been ruling in my favor. I've had, like I said, numerous surgeries. I know this is like unfathomable. My entire immune system shut down like after COVID. I was developing like these abscesses all over my body. And my latest was ending up with basically a golf ball sized kidney stone, a 3.2 centimeter kidney stone in my body, not millimeter, but a kidney stone. When I went to ask for help and said that I think this has to do with COVID, initially I was laughed at. But weeks later, when people started to like look at things, while I was hospitalized for COVID, I was placed on an HIV medication. You know, when I was hospitalized for COVID, I'm fortunate to have gotten COVID when I did get COVID. I can't imagine having gotten it sooner. I can't imagine having to have been intubated. But, you know, getting COVID today versus getting COVID like a year or or almost 2 years ago, I don't know what to say. I was placed on this HIV experimental treatment called Kaletra. And one of the side effects were kidney stones. And when I went to my job saying, hey, I have these complications, I was called unprofessional, that I should schedule like elective surgeries outside of work. It's fine. It's okay. The world will hear the truth eventually. I don't have anything else more to say. It's really unfortunate.
Thanks, Lou. Dom, any thoughts on this topic?
Well, I think that the New York City Fire Department, luckily I work for them, they've been very proactive in terms of care for their members. As a social worker, for example, we're on call 24 hours, 7 days a week. So even when that particular part of the department is closed, say after 9 to 5 or on a weekend, there's always somebody there to take the call. So there's 5 of us. We were all active, since I'm the only one that's not now active. But basically, fortunately, I work for a department that would give me the opportunity to give somebody up to 2 weeks off medical leave. So we understand people, they get hurt, physical, break a leg, sprain an ankle, but at least the department is recognizing mental health. So I'd say that the FDNY is probably more proactive than most other agencies in caring for its people.
Thank you. I want to thank all 3 of you for your bravery, and we do have a comment on that. Thank you to all three of you. Your bravery to talk with us about what you're enduring is powerful. I feel that if any of us has been triggered by your talk, it speaks that much more to the trauma that we are all experiencing. So you are all doing amazing things, and we thank you for that. We have a comment from someone who said, as someone who works with the World Trade Center responders, thank you for all the work you are doing for first responders and frontline workers. It's not easy, and you are all incredible to face these challenges head on, especially with the recent anniversary. I know it is challenging. And then Dom, from one social worker to another, thank you. And Lou, wishing you nothing but the best of health going forward. You guys are amazing, and thank you for everything you do. A couple more things. We did want to touch on preparedness. Any tips for people? And this might be a firefighter question, but tips for personal preparedness. But I mean, it applies to healthcare too, because there can be all kinds of disasters. And any suggestions for people to be prepared for what's going to come? Who knows what's going to happen? Dom, you want to go first?
Yeah, sure. I'd say as a firefighter, one of the things that we're always doing is training, and it just never stops. And it's a type of profession, there might be a lull for a long time, and then all of a sudden there's chaos. So I think you really always have to be prepared. And the best thing to do to be prepared is practice, practice, practice. So I think always be honing your skills. Every opportunity that you have to improve upon your skills, whether it's a class or interaction, I'd say take advantage of all that. In terms of being prepared, sometimes I get deployed to go to a different event. I just try to be as flexible as I could be. I keep in mind, for example, when you go to school, social work school, you hear over and over again, it's always about the client. It's always about the client. So, think along those lines, like you're there to serve and you're there to help, and don't take it personal if there's somebody that can do it better than you. It just might be that you're not a good fit. So I'd say flexibility and practice, always be honing your skills, like a firefighter will be drilling all the time. And as a social worker, there's different ways to drill and different ways to refine your skills.
Thanks. Kristen, any thoughts?
So personal preparedness, big fan of this. If you're not sure where to start, your local county emergency manager, your hospital emergency manager, your local health department, they all do hazard vulnerability assessments on your communities every single year. And it's something that you can personally do too. What am I vulnerable to in my area? Is it flooding? Is it tornadoes? Is it ice storms? Is it winter storms with power outages? And then make plans for those. Do I need to have, I remember the ice storm when I was a kid. So my house has always had a wood stove and I heat with wood, and I've always had 2 weeks supply of food. Do you have batteries? Do you have a second story home? And do you have a fire escape ladder somewhere available on that second story? So it's really just going through this personal assessment. And I think starting with your community vulnerability assessment is a great place to start, but then look at what you're vulnerable to. Do you have a diabetic in your household? Do you have enough medication? What happens if you lose your fridge? Do you have elderly folks in your home that might be vulnerable to heat? And do you have ways to cool? What happens again if the power goes out in the summer in your air conditioning? So I think just doing those personal plans for your family, especially important to teach them to your kids and practice them. Your fire escape plans, you should be drilling those. Smoke detectors, CO detectors, all those things we should be checking regularly. We should be talking to our families, to our kids about what the different sounds mean, what should they be doing. If you hear the smoke detector going off in the middle of the night, roll out of bed. And certainly if you have questions about these things, there are so many community resources. Your fire department would be so happy to talk with you about making a personalized plan. Your public health department also is a great resource. They are so happy to come out and talk to you about plans and resources that are available to you in your area. So this kind of planning is being done all the time. You just need to be aware of it and tap into it.
Great, great answer, Kristen. Thank you. Lou, any thoughts on public health preparedness?
I've just witnessed a lot of people, folks in my area, for cultural reasons, educational reasons. Dom can tell you, resources are just used so just very inappropriately. People calling ambulances in the middle of the night, for a pregnancy test. The fire department getting summoned out for like a leaking toilet. It's funny, but it's just completely absurd. And one thing that Dom mentioned, two things that Dom mentioned. But one in particular, he mentioned, if you can't, you as the doctor cannot be expected to be able to perform everything. And there shouldn't be any shame, asking for help, whatever it is, just to make sure that your patients have the best best care and the best outcome. But there's one thing I just want to mention, just one lesson that I think should echo in everybody's head. And it's something that Dom and I have spoke about in our many talks. And I'm sure he's wondering. But I want you to think about when you get on the plane and those announcements that they make before the plane. And every time I take a flight, I always take a picture of the announcements. Why does it say, put that oxygen mask on your face before helping others? They say it a little bit more eloquently. I'm a little tired. I'm not able to recall it. But I think that there's such a deep meaning behind that. I don't know.
I could chime in a little bit about that, if that's okay.
Of course.
So basically, we used to have a talk. We used to go back and forth a little bit, and I think it's really hard for us to practice self-care. We're so used to helping others that's what we do, and we're comfortable doing that. We feel good doing that. So when you get on an airplane, it says there's usually, for those of us that travel on planes, above your seat, it says those traveling with small children, and you start reading it, and the expectation is that if the oxygen masks fall, you're going to take care of your child first. But it doesn't say that. It says probably what we don't expect, put your oxygen mask on first. And, at first when I saw that, because I travel with small children, I got a little angry. I was like, why wouldn't they want us to take care of the child first? But if you think about it, it really makes a lot of sense, because really you're the one providing care. And if you want to provide great care, it's critical that you care for yourself, because what if something happens to you? Not only, does something bad happen to you, but you can't provide care for the other people. So it's just a small, like snippet, but basically it makes a lot of sense. And we tend to get away from that. And really, if you're not taking care of you for you, well, then take care of you for all the other people that you're tending to and that you're trying to help. And maybe that will motivate you a little bit more, to practice self-care.
I think you summed that up very eloquently, Dom, and I think that might be the key takeaway from this program is that we have to take care of ourselves individually and our coworkers in order to take care of our patients and our clients. So thank you. That was summed it up great. So it's starting to wind down. I don't want to go over time. I want to thank Kristen, Lewis, and Dom for sharing their experiences with us and their knowledge this evening. And thank all of you for attending the program. For those of you who are requesting CME credit, you will get your certificates by email in the next couple of weeks. As I mentioned earlier, we are planning